You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you for joining me on today's episode of Simple Health Radio. I'm your host, Dr. Emron. Lately, across the United States, we've seen a large increase in mosquitoes, and with mosquitoes, there are some infections that can be transmitted even to perfectly healthy people. A lot of people have heard on the news about some of the infections, including West Nile virus, so I thought I would take today's episode just to explain a little bit more about what the West Nile virus is and what some of the warning signs are and why people are afraid of it. Now, the West Nile virus is a viral infection that is spread by mosquitoes to humans. So what happens is there is a vector. A vector is basically an infection that goes through a middleman or some type of medium, and then it affects humans. So in this case, the mosquito is the one that transmits the infection from one person to another. The virus itself is not always harmful. However, it causes symptoms that are very similar to the flu, and that's usually why people are seen in the emergency department. A lot of people, about 20%, will have a mild infection, but they're going to have fever, headache, body aches, vomiting, nausea. They may also have things like diarrhea, fatigue, or even a skin rash. So you can see how some of these findings and these symptoms are very nonspecific. So if someone had a fever and a headache, they may not even think about a mosquito bite as being the cause of it. If someone had fatigue and diarrhea, they may think it's something that they ate and not really connect it with a mosquito or other type of infection. And that's why a lot of people may not even have it on their radar, and oftentimes those people are perfectly fine. So they're sick for a couple of days, and then they improve all on their own. Now, the ones that we worry about fall into that 1% category. So that 1% are people who develop something called encephalitis or meningitis. Now, both of these are very serious infections because they cause neurologic problems. What that means is the infection, the virus, multiplies rapidly and it targets certain parts of the body, including the spinal cord, the brain, and then the surrounding areas. Now, encephalitis and meningitis are very similar. They're related, and those people are very sick, meaning they have a very high fever, they have a severe headache, they'll even have things like stiff neck, they'll be disoriented, they act confused, they don't make any sense when they're talking to you. And then some people will have full-blown seizures, or they may have muscle weakness and paralysis. Unfortunately, out of those people, from that 1%, some people will die because they may have other medical issues, health problems, things that led them to be immunocompromised. And so those are the ones that you're going to read about in the newspaper or on TV, on the news, because they were perfectly healthy people, seemingly, until they developed this infection, and then they died rapidly. And that's why people get nervous, because when they hear that a mosquito can transmit encephalitis or meningitis, then they're very concerned about their family members, their friends, their community. And that's why people start researching about what to do and how to avoid it. Now, there are a couple of things that we know. Mosquitoes are more likely to be out in areas of public places, anywhere there's standing water, anytime the weather changes just enough to allow those mosquitoes to breed faster. So the first step is prevention. We encourage people to avoid mosquitoes whenever possible, use repellent, even things like DEET, D-E-E-T, which is an insect repellent that some doctors and other health groups don't like to use. In this situation, the benefit of using it outweighs any risk, meaning if you can prevent an infection by using insect repellent, I highly advise it. Even to a pregnant woman, even to a young child, the risk of DEET is very low relative to the risk of developing a serious complication that may cause hospitalization or even death. So talk to your doctor if you want to really get the full details on that. But insect repellent is definitely required. Now, if somebody, for example, came to my emergency department, they had fever, vomiting, they acted like they had meningitis, and we don't know if they were exposed to mosquitoes, at that point, it doesn't matter because the workup is still going to be the same. Those people need to be hydrated. We need to make sure they don't get dehydrated from the fever. We need to give them some IV fluids. We need to do some basic testing, which includes blood work. We need to do an x-ray, rule out things like pneumonia. And then we have to do a test called a lumbar puncture, which is a spinal tap. If you remember, we talked about the virus. When it's aggressive, it affects the brain and the spinal cord. So with the lumbar puncture, we're actually taking a sample of the fluid, which is called CSF fluid, but it's at the base of the spine, so very low, almost near the tailbone area. A lumbar puncture, it is a needle, it is inserted into the back, but it's very mild, meaning it's worth getting that test done. We need just a little bit of that fluid to test under a microscope. We do bacterial testing, viral testing, and we can find out what's going on and potentially save that person's life. Without a lumbar puncture, then we're looking more indirectly, because there's not really an easy blood test to document or determine if the West Nile virus may be causing those issues. Now, if the person doesn't respond to the basic treatment in the emergency department, they're going to be admitted to the hospital, and then additional testing will be done, CAT scans of the brain, maybe an MRI. They may get a consultation with an infectious disease doctor or a neurologist just to be sure that we're not missing anything else. And there are some send-out tests, meaning there's blood tests that can be sent to the CDC, which is the Federal Health Department, or to other specialized labs, and they can tell us if there was evidence of West Nile virus. However, we can't wait for those results because it is a virus and may continue to worsen, progress if we don't treat that aggressively. Now, as I mentioned earlier, there are some people who will die because of West Nile virus. Oftentimes they have underlying medical problems. Maybe they have cancer. Maybe they have diabetes that's untreated. Maybe they're immunocompromised. Maybe they had a kidney transplant. So those people are in a unique situation because any type of infection can potentially be very serious, causing life-threatening illnesses. For the majority of people, hopefully that will not be the case. Now, the West Nile virus will come and go, and as winter comes and fall comes, the weather drops, the temperature drops, those people are going to be less likely to be in contact with mosquitoes. So then the following year, it's going to redevelop again in the summertime. So right now, to our knowledge, there's no way to vaccinate against West Nile virus. That may change in the future. There are studies being done. There's a lot of research out there. And it's interesting that even people who, for example, are breastfeeding, there's a tiny chance of transmitting the virus to the infant, but the benefits of breast milk are so high, we advise women to continue breastfeeding. Even if they are exposed to mosquitoes, even if they have a possible risk of an infection, the mother is not going to make her child sick by continuing to breastfeed in most cases. So we encourage them to continue doing that. And then even things like blood donation. There is a shortage of blood nationwide, and there's no easy way to make up for that. So if people are possibly exposed to West Nile virus, the blood will be fully tested, and it goes through a large number of quality control analysis in order to be sure that there's no problems with that blood. So we still tell people, disclose if you have a fever, tell whoever you're donating your blood to that you may have been sick, that you've had these symptoms and so on, but they're going to test it before they give it to the next person because we do have a shortage of blood nationwide. So I hope you learned a little bit about the West Nile virus, what it is and what it isn't. Again, most of the symptoms are mild. A majority of people, even if they are infected, are not going to go to the emergency room for it. The people who do go to the doctor usually have fever, headache, nausea. They may feel ill overall. The doctor may do some basic testing and find a cause. However, that 1% is the cases that we're really looking for. The people who are so sick that they have meningitis or encephalitis, those people really need to be in the hospital. They need to get aggressive treatment, hopefully to save their lives. But if you have any experience with West Nile virus in your community, please give us some feedback. If you found out some tips or some other information from your health department that you would like us to share to our listeners, I would appreciate that as well. And I look forward to having back all in a future episode. Thank you.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.